In this lecture, we will discuss precordial or chest lead reversal and how to identify it on the EKG. In previous lectures, we'll look at various combinations of limb lead reversal. Here we will look at precordial or chest lead reversal. That is reversal of one of the precordial leads, which are leads V1 through V6. Okay, so if you look here, our limb leads or our electrodes were here on the right arm. We saw the left arm. We had one on the right leg, and we had one on the left leg. Now we're taking a look at what happens when we switch some of our precordial leads. Okay, so from V1 all the way to V6, which are positioned here. Okay, so those are our standard precordial leads. And what happens when we exchange one or more of those? Okay, so here's lead V1, V2, V3, V4, V5, and V6. We won't go over those positions, but you can obviously see them here if you're interested. Now, if you recall, we should have normal R wave progression in the precordial leads in which the R wave progressively increases in amplitude from lead V1 up to lead V5, okay? So remember, normal R wave progression, which we see here in the precordial leads, is when we go from V1 all the way up to V5, and notice that we increase in the R wave amplitude. Okay, so let me just erase this here so you can see it. We have an initial small R wave there, and then you can see it getting bigger, the R wave increasing in amplitude as we go up until V5. Okay, and why is that? Well, as we go from the right side to the left side. Remember, our left ventricle makes up the most mass in our heart, and because of that, it will have the strongest electrical impulses, and that's why we see these R waves that increase in amplitude as we head from V1 to V5. Okay, so that's normal R wave progression. Now, if there's loss of R wave progression in the precordial leads, it may indicate infarcted myocardial tissue in that region or another abnormality. One of those other abnormalities can be from something not intrinsic to the heart, but rather from misplaced chest electrodes. Chest lead reversal can result in abnormal R wave progression. For instance, if leads V3 and V4 are reversed in a normal patient's heart, it may appear as if leads V4's R wave amplitude is less than that in lead V3, and then all of a sudden there again increases in lead V5, and this would be considered V3 V4 reversal. Okay, so let's look at this sort of reversal. Okay, so V3 V4 reversal, and that's here's lead V3 and here's lead V4, and we're pretty much saying that they're switched. Okay, so if I erase that here, we're saying that there's misplacement of lead V3 and V4 such that they're switched. Okay, in a normal young patient, someone without any structural heart disease will have progression that you'll see will be exchanged. So remember, here's V3 and V4. Notice how we increase in our R wave amplitude. All of a sudden, we're increasing a little bit, and then all of a sudden, we go up to V3. That's much higher. Then it drops, and then increases again. Okay, and that should be something alarming to you, or something to say, hey, what's going on? Because if you were to switch V3 and V4, you'd actually have what we have up here in this normal R wave progression. So that's just something to see if you have a normal EKG and then all of a sudden you see this, but the patient's asymptomatic, young patient, or has no history of or risk factors for heart disease. You may look at the electrodes and make sure that they're not reversed. Okay, so again, if your patient appears to have no overt heart disease and the EKG looks otherwise normal except for a few precordial leads, make sure to check the lead placement, okay, where those electrodes are placed. Okay, 2 leads or electrodes may have been simply reversed. Hopefully that makes sense. Okay, and it's much easier to identify than some of those limb lead reversals. All right, let's review what we discussed before we end here. So precordial or chest lead reversal, in this case, what we're looking for is an abnormal R wave progression. Remember, normal R wave progression is when the R wave amplitude progressively increases from leads V1 to V5. Okay. Now with this precordial or chest lead reversal, we're looking for abnormal R wave progression. Okay. It may suggest underlying cardiac pathology, or in this case that we're looking at with this chest lead or precordial lead reversal. Okay. Again, abnormal R wave progression. And if we saw that from V2 to V4, okay, notice from V2 to V4, we see abnormal progression, and then it increases in V5 back to normal. In that case, we simply have leads V3 and V4 that are reversed. So we call that V3, V4 reversal. Okay, so hopefully that's making sense and it's not as hard as some of those limb lead reversals. Well, that's the end of this lecture. We discussed precordial or chest lead reversal and how to identify it on the EKG. I hope you learned something.